Well, hey everybody, Dr. Bulow here with Revive Upper Cervical, and I wanted to take a minute and talk to you about inner ear disorders, particularly fullness in the ear, ringing in the ear, and difficulty hearing. This month is the month of September, and in September we celebrate essentially the birth of the chiropractic profession. And my pop quiz to my patients is always, do you know what the very first chiropractic patient had? What was the ailment that inspired him to talk to D.D. Palmer, the founder of chiropractic, right? At the time, D.D. had never adjusted a single sole. He was kind of a modern, at the time, like an allopath of his day, right? Very naturalistic, that sort of thing. And the first patient, chiropractic patient, was a gentleman named Harvey Lillard. He was a janitor. And this was back in 1895. Harvey came to D.D. and talked to him at the end of the day. Harvey told D.D. Palmer he had lost his hearing. It wasn't neck pain, it wasn't back pain, it was deafness. Right? Deafness. Now, we don't know the differential diagnosis, but the point was he couldn't hear well or at all out of one of his ears. And lo and behold, a few adjustments later, a few chiropractic sessions later, and his hearing is restored. Puts chiropractic on the map as a new healing profession. Palmer just theorized that something was off with Harvey's spine because Harvey told him that his hearing had gone bad after he had heard a pop in his neck or a pop in his spine somewhere after he was working in a stooped position. Take that to modern day understanding of the spine. What we know is that right above your neck is your brainstem, the bottom of your brain. It's the most important area of your body, and it controls and coordinates every tissue and cell in your body. And one of the bigger nerves to come off, or one of the more important nerves to come off the brainstem, is the 8th cranial nerve, which regulates your hearing. It also regulates your balance. Right? There's a couple other cranial nerves in there that, along with the 8th cranial nerve, help to regulate the tension of the eardrum. And when you put all these things together, you start to realize that these nerves influence not only the quality of your hearing, but the quality of your balance, ringing in the ears and tinnitus, fullness in the ears, ear infections in little kids. This is really important stuff, and we see it on a daily basis. People that have been to neurologists and vestibular therapists and post-concussion centers and things like that, that they still have this disequilibrium is what it's called, when you can't quite find your balance. And what we find is that it's not a coincidence that those same people had a history of whiplash or head or neck trauma earlier on, before these symptoms started. So here's the challenge to you today. If you know somebody, or you yourself have been through traumas, accidents, and injuries, you've lived life, right? All of us have. And you're just dealing with these chronic ear issues, ringing in the ears, tinnitus of the ears, balance, vertigo, fullness in the ears. Maybe you have a child with ear infections. May I suggest to you to have your neck checked. We'd be happy to help you find someone in your area. If you live in the Western Pennsylvania region, we'd love to be that person for you today. Let us know, contact us, we'll find you someone that can do that. We just had a gentleman come down all the way down from Erie, and on his drive home, his ear opened up for the first time in 6 to 7 months. That's some pretty awesome stuff, and we'd love to be able to facilitate that for you, whether it's in this clinic or finding you a doctor that does this type of work in your area. Thanks for watching, thanks for hanging out. Please share this video. You never know what difference you can make in someone's life, and we'll see you next time.